Thanks for joining the Ken Pittman Show, folks. And at this time, I'm going to bring to the phone Congressman Barney Frank, who is probably in a pretty good mood based on the health care reform bill finally passed after a long, long battle. Welcome to the Ken Pittman Show again, Congressman Frank.
Thank you, Ken. I'd be in a better mood except for the fact that after we finished voting Sunday night, we had this big fishing meeting in Boston on Monday morning. So having made the 6:30 a.m. flight and back, there are days when I felt better.
Well, yeah, Dr. Lubchenco has not been kind to the fisheries. And I know that your preference was Rothschild.
Correct.
Did you speak out about that nomination before you supported it?
Oh, I never supported it.
You never. But did you resist it in any way? Did you tell the president you didn't want her?
Yeah, I campaigned very hard for. Well, actually, what I was looking to get for Brian Rothschild was not her job, but the job immediately under her, which is director of the National Marine Fisheries Service.
Right.
And I campaigned very hard for that. I spent a lot of time with Rahm Emanuel and others. I was disappointed she didn't pick him, and I think it's probably because they were afraid that he knows so much. So I've been very very explicit in my disappointment there. And now I was very clear about, at the meeting we had yesterday, there's this tendency for everybody to be polite, and I said I don't want to be rude, but let's be very clear. We disagree with Dr. Lubchenco on a very critical point. The bill that I voted against that passed in 2006, the extension of the Magnuson Act, says you have 10 years to replenish the stock. Well, that's an arbitrary figure. And in some cases, if you went 13 or 14 years, you'd still get the stock replenished with much less economic damage. And so one of the fishing representatives criticized it 10 years, and she said, well, that's not my choice. That's what the law says. I jumped on that and said, fine, because I'm having a meeting tomorrow with a bunch of representatives and senators from up and down the East Coast, Democrats and Republicans. Scott Brown and I have talked about it. He'll be there. And I said, well, if that's the case and you're blaming the law, help us change the law. Whereupon she tried to back off and say, well, I'm not necessarily for changing the law. And I said, well, if you're going to resist our efforts to change the law, then you can't blame the law. You can't say, well, that's what the law says, is if you have no choice, and then keep us or try to stop us from changing the law. So, frankly, that was a concession that she made that she may not have intended to make, and we're going to use that and try and get some flexibility into that bill.
So there's been no windows of time to get Magnuson-Stevens changed?
No, it unfortunately was reenacted in 2006. I voted against it. I was very disappointed. It was a lame duck Congress that passed it, and the president signed it. And ordinarily, this bill is supposed to last, 7 or 8 years. But we are now, I guess, some of the people who disagreed with us then and supported it, the rigidity needed to show how it wasn't working. And some of the members of Congress who opposed us last time and voted for it now understand the need for changing it. So that's why, even though it's not due to expire, I've initiated this meeting to begin to get a coalition together to get it changed.
All right. Well, we agree with Dr. Rothschild. I think he was a smart nominee, so I agree with you there. On the health care bill, I mean, I don't know that I can be convinced that this is good for Massachusetts residents. You voted for it. Why is this good for Massachusetts when it seems like more money is going to be going out? In fact, it is going to be going out than coming in for us.
What money is going out in your mind?
Well, I think that we're going to be subsidizing some of the poorer states as we're one of the richer states, as the equation reads.
Well, that's been the case, by the way, for some time. Yep. That is, the poor states on Medicaid get a higher percentage than Massachusetts. On the other hand, we get more money in other ways. For example, our medical schools. And one of the things that our congressional delegation fought hard for was to make sure that there was recognition of that it's more expensive for the hospitals that are attached to medical schools. We're one of the leaders in the country and in the world, indeed, in medical education. We also have, medical equipment is a very important thing for Massachusetts in sales and biotechnology. So to the extent that you have more money going to provide good health care, we benefit from that. But nothing changed in the formula about poor states and rich states here. As a matter of fact, one of the things, again, that some of my colleagues took the lead on because they were involved in the health care, Massachusetts had already, before this, reached a higher percentage of our people on Medicaid than other states. And the bill said, okay, we're going to give states a reward if they increase that. And we said, well, that's unfair to give them a reward for getting to where we already are, and that was fixed. So we will get compensation for that as well.
Is that in writing? And that's because I know
it's part of the bill.
It's in the bill.
Yeah.
All right.
Mike Capuano took the lead on that.
Okay, so it's guaranteed. It's in writing.
Yes.
All right. Now, how are you going to stop employers from just dropping people and taking the $2,000 hit instead of paying the $10,000 coverage?
Well, employers could drop the people now and not take a hit at all. I don't understand that. Employers give health care because they want to, because they think it makes good business sense. Right now, nothing is stopping an employer from dropping it. That one totally baffles me.
No, I can tell you why. Because now that they're morally thinking, well, they're going to get picked up. They'll get the help. If I did this before that, they wouldn't get the help. Now I can just drop them. I'm going to save in some cases $8,000 an employee.
I again disagree with you. I think employers who didn't want to give their own health care would just walk away from it now. This makes it less likely that they walk away. Plus, if they walk away, people aren't getting, depending on where the income is, they're not going to have it all paid for. The other point, by the way, I would say this. I think to the extent that we have less employer-paid health care and more just individuals getting on their own, that's a better thing. I think this system of doing it through employment is not a good idea. I don't think it's good for the economy. So I think that's if that's an effect, I think that's better public policy. I don't think this linkage between your job and your health care is the ideal way to do it.
Well, again, if I'm a small businessman and things are tight, I'm going to say they'll be fine. I just drop them and I save $8,000 a person if it's a $10,000 policy.
But then why are you opposed to that? Don't you want the small business? Excuse me. Don't you want the small businessmen to be able to save it's tight? Why isn't that a good thing?
Well, it's not good for the taxpayers.
Well, no, the taxpayers aren't going to be picking
it up. You're forcing the taxpayer to pick this up.
No, there's no taxpayer subsidy here.
Of course there is.
If the employer drops an individual, depending on what the individual is getting paid, there's no taxpayer subsidy for
as a matter of fact, if they make too much money, they're not going to get subsidized, but they won't have that plan, and their employer just pays the $2,000. So the middle income, the lower middle income.
Yourself. Ken, I know you want to be.
Of course, I'm not contradicting. I'm making perfect sense, Mr. Frank. And if this thing was such a good bill, why did the union seek shelter and get shelter from it? Why did the president have to bribe 2 senators? Why on earth is the spigots being turned off in California? And
tell me when it's my turn.
Sure. When I'm finished making my point, if this was such a great no-brainer, then why did everybody have to get bribed like Senator Nelson and Landrieu and the spigots now turned on in California because a congressman over there now says he's going to vote yes or voted yes on Sunday night? Backdoor deals with pharmaceutical giants that now benefit pharmaceutical giants. They now have 12 years of intellectual property compared to 6. I came to find out earlier today. This thing was bought for, and nobody was going to vote for this thing until they got special consideration.
Well, you couldn't be more wrong. A lot of people were going to vote for it.
Well, that's true. You were.
I'm sorry, Ken. Please, you tell me when it's my turn.
It's your turn.
Okay, no interruptions. Thank you. Many people are going to vote for it. In the House, we didn't have those special deals. You say, they had to buy this senator and that senator. Well, that didn't apply in the House. And as a matter of fact, one of the things that we did was to insist that the special deal for Nebraska be undone, which it was. As to Louisiana, I think that's fair. That was reflecting what should have been done after Hurricane Katrina. I don't regard that as a special bribe. I think that was something that should have been done back then in terms of helping the people of Louisiana who were hurt. But the Nebraska deal was undone, so there was no special deal there.
It was necessary at one point, was it not?
To get the votes in the Senate, but there was enough good public reaction against it, including from many of us in the House, so it doesn't exist anymore.
Wait a minute. You said that nothing was done in the House. Stupak didn't get any considerations for his airports?
Excuse me. Stop changing the subject.
You just said you didn't get any considerations in the House, Congressman.
Stupak, I said that one wasn't necessary in the House.